Hello everybody and welcome to the Kirby Institute's weekly seminar. My name is Andrew Grulich and I'm Theme Director of the Populations and Prevention theme here at the Kirby Institute. Today we have a special World AIDS Day seminar, a conversation between Professor Basil Donovan and Julie Bates, AO. I'd like to begin by acknowledging the traditional owners of the land that we meet on today and here, that's the Bidjigal people. And I'd like to pay my respects to their elders past and present and emerging, and I'd like to pay my respect to Aboriginal and Torres Strait Islander who are attending today. Some brief housekeeping to start with. It's not a simple presentation today. We have a seminar, which is a conversation between us two speakers followed by a Q&A. We invite you to interact. We have two speakers who are very used to being questioned and they would love to answer your questions. Julie and Basil will be doing that at the end. So you type your questions throughout the talk and discussion. To ask a question, click on the icon with the speech bubble and question mark in the top right corner to open the Q&A chat screen. When you click on ask a question, please remember to write your name. It does help us reference your question. When the questions begin to build in that window, you can upvote any questions you would like to be answered. You can also change the order by clicking on the tab at the top right, which says most recent, and changing it to most liked. So today is the 39th year of AIDS, I suppose. It will be our 40th anniversary next year. And of course, it is a rather extraordinary year in that we are living in the year of another pandemic, another very different pandemic. And I think it really is an interesting time to be looking back as well as thinking about forward and hearing from two elders who were there right at the beginning, and in fact from before the beginning. So without any further ado, I would like to introduce today's speakers. Firstly, Julie Bates. Julie is the Principal of Urban Realists Planning and Health Consultants. She's an out sex worker and has been a harm reduction advocate and sex worker rights activist for more than half her life. She was a foundation member of the Australian Prostitutes Collective, which was the forerunner of SWAP, and the New South Wales User and AIDS Association, or NUA, the Sydney Hospital initiative that gave birth to the Kirkton Road Centre, and a member of the Australian National Council of AIDS. Of course, even the names sound like they were a long time ago now. Since the earliest days of the pandemic and in a legal environment that still criminalised most aspects of the sex industry, Julie personally confronted some of the biggest brothel owners in Sydney with the reality that in the context of HIV transmission, their businesses would continue to suffer unless they adopted a safer sex attitude and practice. Today, she's a public speaker and political lobbyist for the decriminalisation of sex work and social researcher investigating harms associated with the various legislative and regulatory responses to sex work in Australia, including the Kirby Institute and Curtin University Law and Sexual Health Projects. In 2018, she was awarded an Order of Australia in the Queen's Birthday Honours, and to most of us, she's been a dame for many, many decades anyway. And Professor Donovan, in conversation with Basil. Basil is a sexual health and public health physician who heads the sexual health program here at the Kirby and practices at the Sydney Sexual Health Centre. His research and policy interests include clinical, laboratory and public health aspects of HIV and STIs and priority populations such as sexual and gender minorities, sex workers, Aboriginal people, youth, prisoners, juvenile offenders and travellers. Basil and Julie have worked together for over 3 decades, and through their dedication, advocacy and expert perspectives, they've been key influences in policy change and in achieving the impressively low rates of HIV among sex workers in New South Wales and Australia most broadly that we take for granted in Australia, but in the international context and certainly in the regional context are utterly extraordinary. So I'm sure we're all really looking forward to hearing Basil and Julie's reflection, and it's my pleasure to hand over to them now. Thank you, Basil and Julie.
Welcome, Dame Julie.
Thank you, Professor.
You'll have to forgive me using that title. I've been binging on The Crown.
That's right.
I can't unseat it from my brain. Now, neither of us went out looking for AIDS. It found us. The old pandemic, we can call it. And we were actually travelling on different life courses at the time. I was a grumpy clinician trying to run a practice in Darlinghurst, but you were doing something else. What were you doing?
Okay, I was getting my sea legs as a newcomer to Sydney. I packed up one battered old suitcase with my then 5-year-old son Jesse. You might be watching Jesse, and hopped on a standby flight. Do you remember those? You go to the airport and get a standby flight to Sydney on a very, very stormy night.
Just.
We landed, and Jesse had a major respiratory meltdown. So I spent my first 5 days at the old children's hospital in Glebe. We eventually came to live in Glebe, and as a single mother at the time, trying to make a living and support my child, I'd had dabbled my toes in sex work a little bit in Melbourne prior to coming to Sydney, but my work largely been as a law clerk, and I worked for a man called Solly Ellenberg, who's recently passed away, who was a champion of marginalised people who are coming to the attention of the constabulary in the courts for drug dealing and sex work and brothel owning. And so that's where I cut my teeth, if you like, on being with, supporting and coming to love people living on the edge of society and marginalised. And I actually became one of those people. And so I kind of moved when I came to Sydney from seeing the political as personal to the political now being very personal for me. I decided one night to go see what was on offer in a local massage parlour. I said to my then partner, give me a suburb a bit like South Yarra. He said, oh, that's Double Bay, love. So I went through the paper and saw a brothel in Double Bay, Mistress Davina. And so I went to work with her, or for her, for a number of months until I got arrested. And that was my experience of seeing how corrupt and crooked the system was.
Yeah, I was doctoring in a brothel in Marrickville for a year, which was a real eye-opener for me. I just discovered and later reported disease rates that left Africa or Asia in the shade. I actually got quite a bit of pushback from some of your early colleagues who said, oh, don't turn us into harbingers of disease. We've already got that reputation and nobody in our brothel has ever caught anything. I'm going, well, I've got news for you, darling. And so basically I'd been running this cohort in the brothel for a year. I was horrified by the outcome. And but it's interesting, you came from a sort of legal and public health aspect, and I just came, a legal and a human rights aspect. I came from a public health aspect. And it wasn't always a comfortable marriage in the first instance.
No.
As it turns out, I was actually at the first public meeting of the Australian Prostitutes Collective and signed a book that made me a member. No one asked for any references. And someone's lost the book, which is probably for the better.
And I have to say, we were looking for allies with a heart. And you were pegged as a doctor ally with a very big heart and someone we needed to bring into our fold. And there comes this other place where we link and we share customers. So you would send me some of your customers who might need a little bit of advocacy and help around the edges of their sex work. And I would send you customers that probably needed a good doctor to, as we all could use a good doctor.
Some of them needed more than one doctor, as I recall. There were some walking tragedies out there. Can we get into the APC? And it was formed, and it probably just formed before the New South Wales Parliamentary Select Committee, which eventually reported in 1986, as I recall. Can you tell us a little bit more about the foundation of the APC?
Well, let's just go back to the Rogan Inquiry, as we call it, the Parliamentary Committee, and it was the first time that sex workers were given a platform, a safe platform, to address some of the issues we had around what we knew is absolute pervasive police corruption, and you know, you never knew whether you were going to get home to pay your babysitter that night or end up in the lockup, and it happened to me a number of times. So this was a good opportunity. I just recently arrived in Sydney. I addressed that inquiry. That was one of many inquiries police inquiries and what have you, I've been involved with now over the years. But they listen with respect to our issues. And the recommendations that came out of that inquiry were really, really profound for its day, including the decriminalisation of sex work. And that's 1986. It would take us another decade to see that in totally. But by the end of the 70s, though, it's just stepping back a bit, we actually saw the decriminalisation of street-based sex work, which is an amazing thing. That inquiry also recommended funding the Australian Prostitutes Collective. And there's a little thing out there called primary health care kind of place in the Cross that will look after sex workers and other marginalised people. And that became the Kirkton Road Centre, which continues today. So we got our funding. I was just showing you a little article before, Basil, headlines, brothels call end to unfair bonk ban, crippling livelihoods. You know, when it's about sex, male editors generally just lose the plot and they just can't help becoming silly children again, you know. We did get that funding, and the tabloids of the day, there were two, one in the morning in those days and one in the afternoon. The morning one said, Harlot's Haven opens in King's Cross, and the other one said, Prostitutes Playpen opens in King's Cross. But we were so serious about what we were doing, and we would get media calls every day and they'd be saying, you collect prostitutes? Strange. It's an old feminist kind of collectivism, which we were still working through and running our organisation in those early days. But we were bringing unto us a whole range of allies, including Basil and lawyers and other people. We knew that we needed to have strong allies standing by us.
Yes, I remember that parliamentary inquiry was fascinating. It was a truly bipartisan inquiry. It was supported by both sides of the House, the final report, which it made over 100 recommendations, all of which were adopted, which was absolutely extraordinary. And I remember when I was appearing before the committee, one of the Liberal members looked at me and said, Dr. Donovan, he said, we've been sitting here listening to a string of pinko lefties, all of whom are suggesting that we should adopt a laissez-faire attitude. That is, deregulate sex work, decriminalise it. Does that seem rather odd to you? And I said, sir, I think you should just live with it. It threw them a bit to see a lot of pinko lefties saying that there was no role for regulation or even really for subsidy of anything.
The idea was, and still holds true today, that local government could not be charged with regulating the land use of the sex industry because they were still holding on to their old tired moral issues and around the sex industry. But it was to be a complaints-based system. That is, that you can start your business and if there's a complaint, put in a DA, development application. But it moved from that to where local government then became the regulators. They still are today, and they're still doing a pretty awful job. So you've got a largely female workforce working in industrial boondocks because that's largely the only place that the council will permit a brothel. And even then, I've had, in my planning practice, 2 or 3 that have still been refused in the middle of these, you know, mechanical factories that crush cars, and after 5 o'clock at night, it's devoid of activity. There's no one there except these women working in the middle of nowhere. The clients are too scared to come. So we need to, and we continue to lobby for change in that regard. Allow us to be in our natural habitat, Basil. You know where that is? Above the shops there on Main Street.
Sure.
Actually at the back, so we can be wheelchair accessible.
Now, before the end of the 80s, you finished up in Geneva. Can you tell us about that?
What I remember, yes. It's a while ago. But I do recall your fabulous Kathleen Kay, who'd been running the clinic, the Sydney Sexual Health Clinic, was snaffled up by the wonderful, fabulous and late Jonathan Mann, who had set up the global program on AIDS at the World Health Organization. And they were running a series of consultation workshops around a whole range of things. And they decided they needed to have one on prostitution. And so I was invited to go to Geneva and participate. I thought just sit around the table and participate, but what I didn't realise when I got there, that I was running the show. And my first task of that first morning, and that first session, was to introduce Jonathan Mann. And he arrived down in his bow tie and his immaculate suit. And I also was tasked, because of my, I don't know, I wasn't an out sex worker, but I perhaps was a bit colourful, or more colourful than most. I was charged with the social aspect too. So these consultations, you all go out to dinner and do things, and then try to get back to some work and come up with a consensus statement, which is always difficult. So I take these blokes, mostly blokes, out to dinner, and a number of times I had to go, excuse me, it's off my knees, As far as I go, I'm the organiser for your entertainments, but for other entertainments, I suggest you pop down the road to the main street on the other side of the bridge.
One of our first combined projects was a commission that we got from the Commonwealth Government to produce Australia's first ever contact tracing manual.
Yes.
Want to tell us about that?
Yes, and you invited me to come and work at the Sydney Sexual Health Clinic with you and Marlene Valecki and others on that. So the task was to do this huge big literature review, and I have to say I'd never done a literature review in my life before. I really winged that one. Thank you, Marlene, if you're watching. To do that, to look around the world at what was being done in contact tracing. And then what we needed to do, we had to invite all of the public health experts in the land, and I think from New Zealand and maybe from other parts of the region, to come together to a 3-day seminar to share their way of doing contact tracing and to come up with a best practice in contact tracing, but to be really aware of the sensitivities of the subsets of populations that we would be dealing with: sex workers, prisoners, people who use drugs, gay men. And so after those 3 days, we came up with this manual. I believe it's probably now into its 3rd or 4th.
Still in press. Still in press.
And I imagine they'll be looking at that, or they should be, and how they can develop further the COVID contact tracing. I think it's a really good guide, because it really does look at involving community, which is probably, we'll talk about that in a minute, it's probably the missing link though in how we're dealing with COVID these days. But anyway, the fun. So you said to me, Basil, I've got an idea. I said, where are we going to hold this thing, I've run a few conferences, in town, in big hotels. He said, we're going to get the quarantine station at North Head. I went, sure, Basil. I bet it's just a museum and you can't even rent it. So I made a few calls, and lo and behold, you could. But the idea was, we'd been to AIDS conferences over the years, particularly the 2nd or 3rd National AIDS Conference down there at West Point Casino, where people who are working really, really hard by this stage at the absolute coalface, losing their friends, losing their clients, dealing with great, sorrow and trauma in their day-to-day lives, would be quite naughty sometimes, So your idea, I believe, was go to the quarantine station, we'll have a captured audience and they won't be able to get out of there. But what happened when on the 3rd day we said the conference dinner is going to be here and it's going to be karaoke. And they all went, So they pulled their resources and all buggered off in a taxi to the city. We didn't see them until lunchtime the next day, so it didn't quite work, Basil. It's a good thought. But the irony, so this is Basil's wonderful ironical sense of humour that I've always loved, was to have a contact tracing seminar at the quarantine station.
Yeah, it was reasonably successful. It took us a number of years to actually produce the manual. We didn't move fast in those days, and there was almost before word processors, so it was a long, painful process. But unfortunately, as I watch the way the current South Australian Premier's attitude towards contact tracing is sort of setting it back a generation.
Yes, isn't it? I've been watching that too.
Because when AIDS came along, the American gay communities were horrified because they knew what contact tracing meant in that environment. It was a very authoritative naming and shaming activity, and they actually rejected the term. They substituted the term partner notification. Fortunately, because we didn't actually have any contact tracers in Australia, the term hadn't been stigmatised in Australia, so we stuck with the original language.
Can you remember the little cartoon that was on the front cover?
Yes, it's a young lady in a clinic.
With the clinician on one side of the table.
Yeah, and she's saying to the doctor, his name? No, I didn't catch that. But still on the cover.
And the manual was dedicated to the late Robert Aris.
It was, yeah, to the great Robert Aris, who one of the many we lost on the way.
Which is always, these days, World AIDS Day, makes me sit and pause and remember the loss of our wonderful friends and colleagues. To see Brett Tindall's memorial wall as I walked in. Many of our friends and colleagues worked until, fighting for their own lives and fighting for others, till the day almost they died. Some of them took the option to self-deliver. Others just lived out their last days in the most horrible circumstances. And so how do you get on and get up the next day and go back to work? And I think that's where we share a little bit of our debriefing and how we managed to survive those times.
All right, we'll skip the debriefing.
The audience at home, Basil, they want to hear.
We managed to work again later on a couple of occasions on the LASH projects in its various forms. Do you have any memories of that?
Whilst we're talking LASH, I think we need to pay respect to the late Dr. Christine Harcourt,
yes,
who was your colleague. She was my mentor, and she was instrumental in kind of pulling together LASH 1. So I came into LASH 1 probably halfway into it, but we decided then we needed to go off to Perth.
That LASH, by the way, was a study where we tried to compare a criminalised environment, which is Perth, with a decriminalised environment, which is Sydney.
And prohibition in Perth.
Yeah, a prohibition environment in Perth, and a regulated environment where they attempted to register and licence all the brothels and sex workers in Melbourne to see if there was any difference in the outcomes.
Outcome, looking at health promotion, availability in brothels, access to outreach programs. Found in Victoria that's quite clearly a two-tiered system under licensing, a totally failed model, which they are reviewing as we speak, hopefully, to take on decriminalisation. New South Wales, we had quite good access to the industry, we still do today, because it's been decriminalised now for over 25 years. And you said, you can go and do it in Perth, Julie, because you can mix with those industry members who are living still under prohibition. You did it here all those years ago, so off you go, break a leg. Well, guess what? I broke an elbow. I didn't break a leg. And my friend, Dr. Rigmore Berger, she rang Basil and said, a medical evacuation, Basil, she's broken her elbow. And he said, she'll be right. She knows what she's doing. So I muddled through the rest of that project with one arm. A bit like today with one eye with the surgery, but you don't need two of everything all the time.
No, don't really, no. So we parted ways for a little while, but then Lash 2 came up.
That's right. That's right. So Professor Linda Selving, I believe, phoned you from Curtin University. She's now at Queensland University, and said, we'd like to go back in for another look, but this time we want to do the whole state. We want to do across all genders and all areas of the sex industry. So you said, give Julie a call.
Yeah, probably.
So I hopped on another flight and off I went to Curtin, and the idea of that research was just really significant. Was to employ sex workers as researchers, to be working with academics in the research field, and so we did. And we, out of that research now, we've published I think 4 or 5 papers. We've just been accepted to write our short column in a book on peers in research, a book chapter, and so that's now a pretty seminal piece of work that says, don't go out and just expect to first of all have sex workers as gatekeepers to get you out there to interview people. They must be part of the whole process. And so that came to pass, which is a wonderful outcome of that research. Again, recommendations that went a bit further than Lash 1. It didn't say that it just was bad for public health. This said quite clearly now, decriminalisation is the only way to deal with the myriad of harms caused by prohibition or any aspect, any criminalisation of any aspect of sex work. So we have that report over there, but we still don't have the government stepping in to say, well, it's time to have another look and review it.
Oh, give it time, give it time. COVID-19, can you tell us what your experiences have been with the arrival of our trendiest pandemic?
I've been asked this question. I've done a number of interviews about what are the similarities and what are the differences and what are the lessons learned, you know. I think our work in HIV has put us in good stead to work in prevention models and to help people kind of get their COVID safety plans together and what have you. But it brings now more complex issues because we're still dealing with HIV. HIV hasn't gone away. I mean, there's 4,000 new infections a day globally, you know? 5,500 women, I believe, a week still being infected with HIV. There is still no vaccine for that. There are treatments. COVID in the mix now makes for a very difficult process of accessing communities, marginalised, vulnerable, hidden communities. So it's just added to the workload of my colleagues from Scarlet Alliance and SWAP and SEED and other sex worker organisations around the country. And I can't imagine what it's like in the rest of the world that don't have the same kind of connections with government and decriminalisation.
You've had a fairly good response, didn't you, from the New South Wales government anyway? We
did. Well, you know, back in the day of HIV, my job was to convince brothel owners to take on a safe sex attitude, you know, help us get condoms on those reluctant male appendages, will you? Now, massage parlours were massage parlours, and if you used condoms, it was evidence you were a brothel, and so you'd be open slather for police, not to close you, just to come and knock on the door and get their brown paper bags filled, you know. So these days, so that was a lot of work to do to try and convince them in a framework that criminalised what they were doing. And I remember Gordon Gray was the man I went to, and he ran the biggest brothel in the country at the time. It was called the Nevada, boasted to having the biggest bed in the Southern Hemisphere. I boast to having done one job on the biggest bed in the Southern Hemisphere. It's where we stood up in the balcony on Bayswater Road, that beautiful old Victorian building, and whistled up customers. Freezing our tits off. I lasted one night.
I told you the story, didn't I, of me chasing a woman across that bed with a syringe in my hand.
Trying to give her a vaccine, give her a...
Trying to give her a big shot of
Oh,
AIDS.
we've both been on that bed. See, it's more connections than you can imagine.
Yeah, we won't go too far with that, but yeah, she was the most reluctant recipient of my divine intervention.
But those shots really quite hurt, didn't they?
Yes, yeah, I'll admit that.
So that took about, I think, about 18 months, didn't it, for us to turn around the sex industry, for it to be, you know, where safe sex was the norm, it was not negotiated. And what Basil was doing at that time when we were out there trying to encourage people to use condoms and you know, if they didn't do that, the business in the toilet anyway. But meanwhile, you're doing the research. You're seeing an amazing decline in STIs amongst sex workers. So clearly it's working, you know. So within about 18 months, we turned the New South Wales and followed by other states around the country to a safe sex industry.
So I'd have to comment that the Australian sex worker organisations were quite outstanding at their reaction to the arrival of women from our north, the Asian sex workers that arrived in large numbers beginning in the late 80s, in part because they were cheaper, in part because they were less enabled to negotiate safe sex, and the clients, a lot of clients were still really wanting unsafe sex. And in a lot of countries in Europe and North America, those migrant women were treated with quite a bit of hostility by the local sex worker organisations, but not in Australia.
No, and I think it wasn't just about them being cheap labour, it was about the exotic nature of who they were. Where clients, some of the clients had already been to Bangkok and other Asian countries, and they came back and they were wanting to see women from other parts of the world, in particular from Thailand and places. But you know, some of the Australian-born sex workers were not too keen because they saw it as competition. And so for those women too, eventually you're tracking their sexual health. They also, it must have been a whole lot more difficult for them because of the language barriers. They too adopted safe practices and
achieve the same health outcomes as other sex workers.
And that was because, Basil, you employed peers, didn't you, in the clinic?
Yeah, not always an easy thing to do. You have to put up with their foibles, but you learn a lot in the process. But back to COVID-19, we've been doing a little bit of surveillance of the industry since the epidemic came along, and in particular looking at how sex workers are projecting and how much people are accessing sex workers via the internet. This is not just Australia but globally, and it's been quite interesting to note that there was quite a precipitous decline in demand for their services. A lot of sites were withdrawn in the first few months of the epidemic, but it seems to be bouncing back.
It is, and you know, it requires a technically savvy person to move your business online, and not all of us have that tech, you know, savviness. But within our very disparate, broad community of sex workers, we have the most amazing people who picked up that, who knew the technology, and were running workshops. So you could learn how to take your business online.
Yep.
So we kept it in-house. So people were then able to do their business online. But it's not for everybody. And so a lot of people did stop work. Some people have chosen not to go back to work. Personally, I'm starting to get calls from aged care homes again. Mr. Smith is being very naughty. Can't you please come on over? What's your COVID plan? You know, I'm not quite sure I'm ready to get back into that field just yet. But I understand that they are feeling very uneasy and kind of unloved and not having their intimate needs met. So I hope very soon that I'll be returning a little bit to visit Mr. Smith and co.
I understand some of your colleagues have been educating the constabulary about COVID-19 precautions.
That's right. Well, you know, the police, even after 25 years of decriminalisation, give them an inch and they'll take a mile. And so they've seen an opening to, they really didn't like decriminalisation. They were part with Nick Keldos of the Move 5 years ago to review, it was the Liberal Party's kind of one of their key features that they would look at when they got into power, if they did, and they did. And it was really to overturn decriminalisation. That was their idea. So they held a parliamentary inquiry and we all presented to and yet another inquiry. Thank God for Lash and for Basil, because the evidence-based research that we had acquired through Lash said it's not broken, there's a few little bits need tweaking, but leave it alone. You know, you can't have a better, if you're concerned about the health and well-being of people, and you bloody well should, leave it be. So that inquiry came to nothing, but you know, there are still people out there ready to have another go, and the police clearly didn't like having their powers taken from them. And so one Saturday night, I got a call from one of my clients out there in Chatswood. He says, Julie, we've just had the biggest raid. Eight cops just arrived, you know. And I said, well, tell me what happened. I hope you're going to go to the station, you know, boss and have a word about this. What was their business being there? They said they were here to see our COVID safety plans. So I said, well, tell me what happened. Well, luckily, one of our best receptionists was just having a bit of a break out the back, coming back on shift in about half an hour, but she could hear all the commotion. Then she saw the cameras and she saw 8 cops arrive and she went, oh. So she went to the front and she stopped them in their tracks and said, you want to come in here? Separate, social distance please, one at a time. She got out her temperature, took the temperature. You stand over there, next. Have you been overseas recently? Have you been to Melbourne? 8 of them lined up. And then they said, look, you're really not social distancing properly. Can't you see the marks on the floor? Would you please separate and stand apart? And then one of them said, could we see a safety plan, please? You've just stepped in it. You know, you've just been put through it. What more do you want? So, yeah, so it troubles me that any mandatory actions that we take can provide opportunities for bad behaviour by police and councils, right? So I will continue to fight mandatory considerations, and one of the latest things that we're seeing from the ministry is to everybody should be having the code, the code, because what's happening when they're going into contact trace, you're keeping written records, they can't read them often. So I'm hoping that the advocacy that we are doing with Scarlet Alliance and SWAP here in New South Wales is to allow us to record that handwritten detail onto a spreadsheet that's kept in the brothel, and it only goes out there if there's a need to trace, because it's not going to work. You're not going to get a client coming to a brothel, getting his little phony thing on the code to know that he's been in, you know, La Petite Roma and Victoria's Secret's over there in Chatswood. You know, like, it's not going to work, and the industry has suffered and struggled hard enough to claw their way back, you know. We don't need any more obstacles, and we do not need to give the police any more opportunity to throw their weight around. But they got a good lesson that day.
Thank you for that, Julie. On that note, we might throw things open to questions.
Thank you for those observations. It's incredible to hear those stories. We have a variety of questions and comments. This first is from Jonathan. I suspect he works in HIV surveillance, and I suspect the question comes from hearing about how much stigma there was in the early days of the HIV epidemic. His question is, how reliable were the data collected in early HIV surveillance? Was there much mistrust in the system of surveillance from people living with HIV and AIDS and for people at risk?
It's a double-edged sword. A lot of our earliest male cases of HIV, well, usually they're presented late, so they had AIDS, actually would blame their HIV infection on the female sex industry, when in fact they were just closet queens. Because in those days, the stigma was probably much greater around homosexuality than it was around sex work. There'd actually been multiple surveys through the 1970s showing that 2/3 of Australians didn't care less about sex work. They had no negative feelings at all, as long as, you know, as long as it wasn't shoved in their face. Should I rephrase that?
Could I?
I mean, sex work, to me, is a rather vivid example of how the population is always a generation ahead of its politicians. You know, in most places in the world, people do not see any great harm in sex work. It's just something that people do. They may not want to know about it, and that's fair enough. But they don't really see it as a useful use of police resources.
Can I just pick up on that? And we didn't quite get to the big issue of discrimination and stigma that we still face in our day-to-day lives, and without anti-discrimination protection around the country, and it really does need to be the bookmark of any decriminalisation model. That research that was undertaken with Scarlet Alliance and the National Centre, I think it is, found that 64% of people and a large number of healthcare workers as well would behave differently or disrespectfully to people because of their sex work. There's similar numbers around people with HIV, but this is sex work. So when you get down to ask people, would they behave differently? Yes, they would. So that research now is going into programs to really start addressing some of the stigma that we face. It's not good enough just to decriminalise our industry. You have to find ways to protect people as well from discrimination.
Thanks, Julie. One for you. Actually, it's not a question, it's a comment, but Sharan, who sounds like she must be somebody you knew a long time ago.
Melbourne.
Right, yes. She just says she's honoured and proud to have been to be an original Victorian ally and to have been mentored by you, Julie. Profound thanks for implementing the Safe House scheme in Victoria. Yeah. What was the Safe House?
Okay, the Safe House program. Well, it was all about encouraging brothel owners to become better people, and to give them something back. You couldn't expect, look, you just got to get condoms, all these reluctant male appendages. You're going to say no to clients that don't want to use a condom. You're going to lose business. But, I think if you adopt a safe sex attitude here and you sign on to our Safe House project, we'll go and check out your premises. And if you look like you're, playing along with a bit with half decent work health and safety sort of protocols there, you can use that symbol in your advertising. So the idea is that you encourage the industry to the clients to come back to the industry to a safe environment, which is what we're doing with COVID safety plans in brothels. It's the same kind of thing. You could use your COVID stick if you've registered your business, the front of your brothel. Back in those days, that little sticker in the Truth and other newspapers where there's nothing online, where we advertised, you could advertise your place as part of the Safe House program scheme, and they took that up in Melbourne with the Prostitutes Collective as well. So it was a really good initiative. One of the many amazing wild initiatives, the Ugly Mug List, for instance, was developed just down the road here by Roberta and I 30-something years ago with our colleagues at the APC. We're sitting around the office. It's still decriminalised. We're in our new fabulous home in Bryan Street with a view out over the Domain. And we're still knowing that sex workers are being treated very badly by the police. And so, they're not going to report crime. We're going, these ugly mugs. Mug was a colloquial term. for clients, and they're ugly by deed. So, I don't know, suddenly in this room, ugly mug list. So we produced a weekly ugly mug list. Now it's online, and but we used to have to take it by hand around to the brothels all over the state. That's been picked up right around the world. So it has different names. It's Bad Trick List, and Bad Johns and whatever. But the ugly mug list was born right here in Darlinghurst. One of our proudest little initiatives, I think, because if you can't go to the police, but what happened there? The police used to come to us and go, "Got the latest ugly mug list?" Well, yeah, sure. And they would say, when you can work with some of the police, they're not all bad. If you can get to them and educate them, they would say to me, "Look, we know where he is, got his licence number, or go pay him a visit. We reckon we'll find something else on him." And they often did.
I've got my own ugly mug story. The New South Wales, the Prostitutes Collective was using some of their funding to produce the list. It was a very small amount of money. Legal branch of the health department looked at it and were horrified. They're going, "This is outright libelous, you're putting car number plates and descriptions of people. We cannot be seen to be supporting this publication." So I made a massive financial contribution. I think it was almost $20. And so efficient was the APC and more recently SWAP at managing that money. They continue to produce the ugly mug list just on the interest they generate from that vast amount of money that I donated 25 years ago.
Basil, a question for you now about contact tracing. And you started talking about this in the context of COVID and the conniptions, shall we call them, that we're seeing where, we have a few cases in one state and the Chief Health Officer comes out and makes somebody seem bad, and then the day after they almost apologise for it because they realise that for good contact tracing, people must not be fearful. People must must not be stigmatised, because why would they give names of everybody they've been contacted with? So given that HIV is still criminalised in much of Australia and in much of the world, do you think we'll ever get good contact tracing for HIV?
Oh, I think we've had excellent contact tracing for HIV, but no one ever noticed. That's what contact tracing works when it's invisible, and it's handled by health professionals who know what they're doing and don't jump the gun, as we've seen with COVID-19, and go, "Oh, someone did this, so they must have been the source for everybody else." In contact tracing, and when pathogens spread through a population, it can often take you 18 months to work out who gave what to whom. And even if you can confirm that one person's carrying the same strain as another person, it still doesn't say who got infected first. So you do not use contact tracing as a vehicle to express your own prejudices. You just use contact tracing as a tool to sympathetically control the transmission of infection and keep the politicians out of it.
I completely get where you're coming from there from the point of view of a sympathetic clinician, Basil, but do you think it's made, well, I think it must be made more difficult, isn't it, by the fact that in many settings these people are worried about the legality of what they've been doing. They're concerned. And I see a reflection in COVID here with people like Chief Health Officers saying something a little out there and then realising, oh my goodness, I'll scare the population, I mustn't do that, and withdrawing.
A little bit too late. COVID-19 has done what HIV did in its day. It's exposed weaknesses in our society. People who have to work in miserably paid jobs, multiple jobs, frequent multiple work sites, and live in crowded conditions. And COVID-19 should be used as a lever to correct some of those inequities in our society.
Just-
we're beginning to hear a few positive noises.
Just look at the way migrant workers were treated, and I don't mean just people working in the sex industry. So if you're out here on some study part-time work arrangement, you couldn't work, but there were no benefits coming your way. The Scarlet Alliance and other sex worker organisations of the country have started months ago now, a fundraiser to provide for those very vulnerable sex workers who weren't able to access job seeker or job keeper.
Terrible situation they were in. Yeah.
Wasn't going to pay their rent, but you know.
Yeah. Julie, back to you. Dr. Steve Bell from here at the Kirby wants to firstly thank you for the contribution to his recent peer research book. This is it's a fantastic read. But he has a question for you. Would you mind highlighting for the audience why it is so important to have sex workers lead research processes?
Oh, that's a really, really good question. Thank you. Because we know what we're doing. We're good at it. We know our target populations. And it's not just getting through the gates of those places, but we're also really good at helping you design the instruments for which you use to gather the data. We're also good at analysing the data too. The interesting thing is to think sex workers suddenly appear in research. Well, we've been there, folks, forever, but you probably just didn't know. And one of the things that it came out in one of our papers on peer researchers is that, you know, if you out yourself in an academic world, it's really quite possibly going to have serious implications on your future. So you'll keep your mouth shut. But so we are there. We are quite frankly everywhere. And the idea was to actively involve and engage sex workers. So we employed, I think it was 8 sex workers from Perth, men and women, some from migrant backgrounds, who had a range of skills. You know, they came in already with you know, degrees in research and other sociology and other fields. You know, so this idea that we're sex workers without a brain, and you know, you just couldn't possibly have you at the research table is really wrong, and I hope we've clearly shown that up for what it is.
And of course, it's equally important for all marginalised populations that we don't come from that. Well, historically, I think a lot of marginalised populations felt like they were researched on and not researched with, and addressing real concerns in their everyday lives and not just something that somebody else perceived from a long way away.
And nobody else, quite frankly, could get into these places, particularly when it's a criminalised environment.
Okay, we have a couple of other observations, but not particularly relating to today's talk. Are there any questions in the room which I could repeat for those online? We actually are beginning to have, for those online, are beginning to have audiences back at the Kirby. We're very excited. We have a socially spaced room, and we are beginning to get towards that post-COVID environment. Okay, if there are no more questions, we just finished by really thanking Basil and Julie for giving us that historical perspective. As I said to start with, I think it's so interesting to have that perspective at a time when we're being faced with a new, different epidemic. And I think there are a lot of differences as well as similarities. I think one big difference is that this epidemic is not in general happening to people who are other. It's happening to people who are mainstream, they're us, if you like, rather than other. And that has made for a very different response, I think, one that has been able to be quicker rather than preceded by years of conversation about, you know, why we needed to, you know, treat these people who are other or like us. So I think that's a bit of a lesson for us all.
Another big difference, it actually took us a few years to work out we were in a pandemic with HIV.
Yep.
It was a slow motion movie.
Yep.
It didn't hit like a bomb like COVID-19 did.
Indeed, the combination of air travel and a virus spread by the respiratory route made for something that happened a lot more quickly. Yeah. Okay, if there are no more questions, we'll wrap it up. Thanks, Basil. Thanks, Julie.